Hey, welcome to the Dr. G Show. This is episode 148.
That would be the Dr. G and the Boss Show.
Dr. G and the Boss Show.
Episode 148. My name is Holly
Hajaj.
Hajaj. I'm the Corporate Wellness Director at the YMCA. And
is that right?
Pretty much the star of the show.
That's what I keep hearing from you. Well, today, or this month, we've been dealing with skin issues. And last time we had our show, we talked about various things, and you guys said that there were some more things you want to talk about. So we're talking about cellulite.
The rest of the story.
Are you sure?
Yes. Is this the last week in July, by the way?
Last Tuesday?
Is there one more?
No, there's one more Tuesday. There's one more. So we got one more show on skin.
That seems like it seems like we've done a lot of shows on skin. I'm just saying.
I know, because there's 5 weeks in this month.
Oh.
See?
So, what do you guys, speaking of that, let's recap just a little bit. What do you guys remember, if you were on our last show, what do you remember about skincare? Have you been using any of those tips or tricks? And if so, what have you noticed? So what have we been talking about? Wrinkles. We talked about wrinkles last time. Did we ever talk about eczema?
No. Oh, that's what it'll be the next show. Next show we'll do eczema, psoriasis, urticaria, rashes, all those kind of things.
Oh, I think we got caught up on styes and wrinkles last time.
Did we talk about wrinkles?
I think, yeah.
Vitamin C, we did talk about wrinkles.
Yeah.
Okay. We talked about styes in the eye.
Today, we're going to talk about skin tags, cellulite, jojoba oil, and scars. We never got to scars from last time.
Scar's my favorite character on The Lion King.
Oh, wow. Thank you for being on topic all the time. I know I can really count on you.
I don't like distractions.
Do you guys have skin issues? If you've not joined us in any of these skin talks, what kind of skin issues are you struggling with? What do you want to know about?
We got to start talking about warts. Did we talk about warts? We
did not talk about warts. Let's do warts.
Right now? Warts are pretty simple.
Oh, look, there's Ryan. Hi, Holly. Hello, Ryan.
Hey, Holly, that's Holly.
There's another Holly.
Is that Ryan?
It's Ryan.
RTE's in the house. So, what are we going to talk about first? Warts?
What do you guys want us to talk about first?
So we can talk about warts. So warts will be pretty simple.
Okay.
Warts are a virus. It's not
a virus.
A virus.
Did you hear that? I'm taking notes.
So its whole goal is to disrupt your own DNA. And so the old myth is that warts come from frogs, right? So one of the defenses of a frog is if you pick it up, or a toad, it'll pee on you, right? So there's so many jokes with that, but I'm gonna skip over that. And so people used to think that they got warts from frogs, because frogs look like they have warts, but it's not true. Or actually toads. So the actual warts that human gets are from human papillomavirus, right? And there's all these different types of it, and some infect different areas. So, like the cervix is one that's a concern for people. But human papillomaviruses go from person to person, and it's not exposure to the virus that becomes the issue. It's your susceptibility. So you have to have some type of break in the skin or irritation or not enough good bacteria to allow that virus to even enter your skin.
When I was a kid, one time I got a wart on my knee. Which would actually make sense because you fall on your knees a lot as a kid. Doesn't that make sense?
I guess.
Why don't you validate my story?
It's unvalidating. So,
did anybody else get warts as a kid?
So I still have a scar from mine. I had one on my finger here, And I remember as a kid, I just got mad, and I was just chewing around it, and then chewing, and I finally just pulled that thing out, and it had little roots on it.
Ew!
And then it just bled like crazy, and then I drank the blood, and then that's how I became a vampire.
That's disgusting.
I tell my daughters if they suck the blood, like if they get an allergy, they suck their blood. I'm like, if you like that, you'll turn into a vampire. That's how they're created. So.
Yeah, that's.
You're not.
I'm glad that you tell your daughters the truth.
I know, it's very important to me.
A lot.
Well, it's only if you have the vampirian gene that's in the blood, right? So the saliva activates the gene, then it's reabsorbed into the blood, and that's how you become a vampire.
Yeah, that's going to be our next show. We'll do that as a special.
We should have a show where we just give complete misinformation and make it sound like it's completely validated.
And you won't know.
Yes.
You won't know. I like this.
Yeah, I feel like we do it every time, but
we could do it around Halloween, but then they might pick up on it.
oh, that would be great.
We have done a Halloween special before.
Yes.
It was a really good show.
It was a really good one.
We got in trouble for it later, but we had a good time.
We got in a lot of trouble, but it's very, very good. So,
warts are a virus.
So with the virus, so then the way that you get it, they're external. So basically, you can freeze them off. So you can buy your own thing and just freeze
When you
it.
say they're only external, that means they're not in the bloodstream or what?
Right. Yeah. You don't have like warts on your liver or warts in your blood. So
you don't have that virus in your blood?
Right. So they really want to attack a certain type of tissue, which then is the epidermis of the skin.
Okay.
So with that, then that tissue grows really rapidly, right? So you're more likely to get warts there and take on, because again, it has this replication process going on, makes it more susceptible. And
I've never had one since I was a kid.
yeah,
What
that's
does
because
that
you're
mean?
healthy. Or you stopped hanging out with those warty kids down the street.
I stopped skinning my knees. I think that's what happened.
Mm-hmm. So, to kill it, you got to kill the cells, your own cells, because your own cells are the ones infected with the DNA from the wart virus. And so basically, you can cut them off, you can burn them off, you can freeze them off. And the other thing is, natural medicine-wise, if you're really patient, you can put coconut oil around it, you know, like that. Protect the skin, and then use like oregano oil or tea tree oil. And those will...
A tough one?
Yeah, those will usually burn down or kill it, but you got to be patient with that. And so...
Why? Meaning you have to do it for every day for 6 months?
No, for several weeks.
Okay.
And the really old school way, which is probably slightly toxic, but it works, is you take duct tape, cut off a little circle, put it over the wart, put a Band-Aid over it, and they don't exactly know why it works, but whatever the hell toxic ass chemical that's in duct tape, it kills warts. So
duct tape does everything.
So you know how women have a diaphragm for sex, right?
Yes.
So they should make a duct tape diaphragm for HPV for women, and they just put it up over the cervix.
And never take it off.
No, have a long string.
Like a tampon.
Right. And then, like, every few days,
and
like,
then
pull
pull
out
off the
and
cells
change
of
it.
the cervix. That sounds really not painful.
I'm just saying, if guys were girls, that's what they would do. Duct tape and extension cord would be fine.
Huh.
So, duct tape.
Duct tape,
Tea
oregano
tree,
oil, tea
oregano
tree.
But protect
Freeze
the
it
skin around
off.
it. Freeze,
What
burn.
about some of the over-the-counter stuff you just put on it?
So, maybe.
I mean, if you're recommending duct tape, you might as well go with something else that has chemicals.
Like a wart treatment.
Right.
They're toxic, but...
If you're okay with toxicity,
and then the other
your
thing
warts
is,
won't be.
The other thing is, why do you keep getting warts? So if you get warts once every now and then, might not be so bad, right? But if you keep getting warts or multiple warts, then that's a big issue. That's got to be a deficient immune system, or the barriers of like good bacteria, mucus, and that kind of stuff. That
Are compromised.
Right.
Okay. Do you guys have any questions about warts?
Yeah. The people should share their warts.
Take pictures of your warts.
Warts are STDs too.
Yeah, that's all HPV, right?
That's
It's
right.
they're all different forms of HPV.
Mm-hmm.
Yeah.
Yeah.
There's I think there's 200 or 300 different types of HPV.
Right. Yeah.
Yeah.
So, and 85% auto-correct themselves. The other 15, it's mainly the immune system that's deficient, that's allowing it to persist.
Speaking of HPV, if we go off topic here for a second, is the HPV vaccine
Oh my
bad?
God! Yes, it kills children.
Okay.
Oh my God! It's killing girls in the prime of their life. That's seriously messed up.
Just asking.
All right.
I didn't know it would touch such a sensitive note.
So if you don't like someone, encourage them to get the vaccine. And then if their kid dies from that, they can't sue the company
Okay.
or the doctor that recommended it.
Dr. G does not recommend the HPV vaccine.
Recommend you getting healthier.
Yeah, what do you recommend then?
Well, with HPV, if women have HPV, most of it resolves, but naturopaths use I think it's called a Veggie Pack. And so basically it's all these different herbs and stuff, and then they, I believe they put it in you make your own tampon, and then you put it up there, and then those end up killing the virus. So instead of doing an herbal treatment on the outside, you're just doing a
herbal treatment
on the inside. Yeah.
Who'd you say makes that?
No, naturopaths have used that for
you'd
years.
want to work with a doctor then to...
Well, no, I think you buy it. It's just called Veggie Pack.
Huh.
Yeah. So,
Okay.
I've had a couple of patients ask about that over the years, but they were mostly just ex-girlfriends.
We can't get through a show, folks,
All right.
without being inappropriate. Just warning you now. If you've never watched us before.
Oh, which, by the way,
This is Wellness with an Attitude.
for those of you guys that are local, and we might do a live version too on Facebook, but I have, 10 or 12 talks scheduled at OptiLife in Wichita on the east side. So if you're a West Sider, you gotta go to the east side to visit the OptiLife for those talks. I think it's open to the public.
Can you please just continue gang signing everything
West
you
Side
say
fools.
tonight?
And we've got Dr. G's like this. What?
Mm.
Representing Dr. G in the old town, OT.
They might be impressed.
They are.
I am not.
Well, they know I'm gangster. And you know I'm a wangster, so you're not impressed.
Okay, so we talked about warts.
Well, wait, one more thing.
What?
And in 2 weeks, we have the Dr. G show, or not Dr. G show. We have the Cooking After Dark with Dr. G.
I thought that was the OptiLife Talks. That's separate.
Separate.
He's doing talks there.
Mm-hmm. Talks.
And
And we're going to do our recorded
cooking show.
cooking show.
What are the talk topics?
That's a great question. I posted them a few days ago.
Okay, stay.
Are you not paying attention to my Facebook posts?
I cannot read 40 pictures a day and 40 posts a day.
I thought you used to work at Barnes & Noble back in the day.
I have a life where I do things for other people.
That sounds like a pretty
Sketchy.
woman situation.
Okay.
Mm-hmm. So warts.
Warts are a virus.
Short term, just treat them, and then long term,
Just
fix the immune
treat
system.
them. You heard it here.
Just
Just treat them.
just let them go. Or you could be like me,
Well, the one, when I was a kid.
chew that thing off.
Oh.
Chew it off. Man, I pulled that thing. I had roots like that long on it, right?
You should have planted it somewhere.
That would have been funny. I made a wart tree. I should have put it in my sister's ear.
I think mine the ones on my knee, I don't think I ever put anything on. I think they just resolved
Well, that's what most of them do.
what they're supposed to do.
Yeah.
Okay, I guess you said
Because you're
that.
so healthy.
Okay, so, as a kid I was. So, warts, we've talked about warts.
Warts, yeah.
Next, what do you guys want to hear about? Here are your choices. Either something... Oh, wait. Before we get to that, Christine, are you still with us? You made a comment about
passed?
skin tags.
She passed away already?
Skin tags.
Uh-huh.
And eating less sugar made less skin tags for
Right.
you. Did they just disappear, or did you have to cut them off? Or let's move into skin tags, because they're kind of close to warts and annoying.
Christine says yep. Hey, there's Tim. All right, so with skin tags, they are just overgrowth of normal tissue. So your tissue that goes along your skin and then in your mouth, all the way pretty much down through your intestines, or at least your esophagus, and then vaginally and anal tissue. Those tissues, or even the colon, are a type of tissue that grows really rapidly, right? And so because of that, they're designed to keep responding to something called insulin growth factor 1, or it's this growth factor that you produce that stimulates growth, right? So you have this constant turning over of cells, right? But what if we add more insulin growth factor?
What's that first word?
Insulin.
Insulin growth factor.
Yeah.
Okay.
Yeah, and it really didn't have anything to do with like pancreas or anything like that for this, but it's a growth factor. So insulin-like growth factor, IGF-1.
Okay. So when we add more insulin-like growth factor 1,
then we grow tissue.
Then we grow too much, an overgrowth of tissue.
That's right. Okay. So the tissue that overgrows, we tend to see, are the ones that are like stratified. Is it stratified squamous? I believe. It's been a long time since I taught anatomy and physiology, but the type of skin that's on your outer part here, right? It grows faster on your face. So then you'll see just parts growing, and you'll get these little skin tags. If you get skin tags on the outside, we call them skin tags. If you get them inside your colon, we call them
I can't help it.
We call them polyps. How'd you know that? How'd you even know?
I just knew. It just makes sense.
Yeah. So polyps, when people have those and they happen to have them removed, it's basically just because they have overgrowth of the stimulation.
But if they're benign, why do they have to have them removed?
Well, because they can turn into batons.
Nah, that was really bad.
So
that's your first dad joke of the night.
So overgrowth of tissue is one thing. So it grows that same tissue. But if you're stimulating it like that, it's more likely to replicate and start causing a change, and then that dysplastic then becomes cancer. So it's kind of like a skin tag, theoretically be precancerous, but there's less growth out here. But on the intestines, it's constantly, you're pushing that poop through there, and so then it's really wearing off, so it has to be faster, and so then it's more likely to grow faster, and then you get these polyps that turn into cancer.
It's wearing it down so it continues to grow?
Yeah, kind of like if you just did this all day long.
So the body continues to replicate.
Right.
More. But then does the DNA change in it, and then it's...
Well, eventually, yeah, you'll end up with mutations. Now, you're supposed to have like butyrate that feeds your DNA polymerase that edits out those mutations, which they do about 10,000 per cell per day, but we don't have a fiber-rich diet, so then there isn't that to edit out mutations, and then those persist.
Okay.
So
we need fiber to edit those mutations, especially if you have had polyps, but for anybody especially.
Fruit and vegetable fiber, right? So the two things that stimulate growth factor, insulin growth factor in your body, is one, dairy. So like the whole point of breast milk is to grow a baby really, really fast.
A baby. Oh, sorry. Go ahead.
So a human...
I was going to talk about cows, but go ahead.
So a human baby, it grows from 7 pounds to 30 pounds, but it takes 2 years of human breast milk to achieve that, right? So even as a baby, we grow really, really slow, but a cow would go from 75 pounds to 1,000 pounds in just 10 months of breastfeeding. So that means our amount is this much, but a cow's breast milk is that much.
Way more growth hormone than we need.
And so if you're nursing from a cow, your tissue should grow out of control, and then we call it cancer.
Which is also why we're bigger than we were 50, 60, 70 years ago.
Maybe.
I thought we talked about that one time in a show.
That sounds made up. I think you've been watching the Pyramid Code too much.
That is not true. We're going to have...
Is this from
dairy show? We're going to have a dairy show.
Is this from Ancient Aliens?
No.
Maybe.
So, dairy stimulates this insulin-like growth factor 1 and also is a contributor to skin tags and polyps.
That's right. So the other one that's in huge amounts is something called sugar. Have you ever heard of that? Sugar. So not fruit. But added sugar, or if you take
refined,
the fiber away,
processed,
then juice. Juice is pure sugar, even more than a soda, and then just added sugar. So the average American, we said, consumes about 150 pounds of added sugar a year, but in 50 different forms.
What's better? Question for you guys, trivia. What would be better than juice if you were going to have a drink?
What's better than juice?
Juice?
That's racist.
Or smoothie?
Oh, juice. Juice, not Jews. Oh my gosh, I thought you were going off the rails. All right.
Which is better, juice or smoothie?
Ooh, yeah. Or a juicy smoothie.
Juice, smoothie.
What if you put juice in the
juicy smoothie?
Okay, what's better? Juice, smoothie, or green smoothie?
Yes, okay, that's a good 3.
All right.
Which is better? It's obvious.
Okay, let's prioritize these. Fruits and vegetables, green smoothie,
smoothie, juice. Which is the best?
Yeah.
Can you please order those in priority and then post?
Can you order them and bring them down here, and then we'll test it out?
So we do want smoothies instead of juices for fiber, but if we could do a smoothie any better, we would want to add greens to it.
Greens,
that's going to add a lot more fiber.
Yeah.
If we want to do even better, just eat the dang fruit. Don't do anything.
Eat your
anything
damn fruit.
Eat your fruits and vegetables.
Yes.
In their original form, as close to their original form as possible.
Yeah. So Christine was right. So you want fiber. The fiber absorbs 80% of the sugar that's in the fruits. So then it feeds your gut bacteria to make butyrate that then edits out mutations for you.
So how does sugar cause skin tags, please?
Because sugar dramatically increases growth hormone and insulin growth factor. So that's why we always say sugar feeds cancer. Because
is that why they call it insulin-like? Because there's no connection to an excess of insulin?
No. It just has that effect. So it's insulin-like.
Okay.
So yeah. So.
Okay.
And basically those kind of things where they misidentified something. They're like, that's not right, scientist Bob. And he's like, well, it's insulin-like. And then that's what they call it.
Yes, Linda, smoothie with fruits and vegetables.
Fruits.
Have you ever made a smoothie with squash? I had someone ask that. I think it sounds kind of good. I've made it with pumpkin puree before.
Pumpkin. Yeah, right.
Yeah. Yes.
Oh, I know squash.
Add those vegetables too.
Zucchini, because I mean those things are like cucumbers. They don't taste like anything.
Yeah.
So I don't know about like an acorn squash or something.
Yeah, it sounds good. I don't know what kind I was thinking of, but I already answered my own question with the pumpkin.
Okay.
So with the skin tags, as far as removing them, Christine, you're more brave than I am. I can't I think my sister uses like a nail clippers.
Yes. Oh my God.
I can't bring myself to do it. What about infection and all of that? And I have the tiniest little one on my eye.
Does it move? Does it change at all?
It talks to me. No, it doesn't move or change. It's so tiny.
Does it say "Feed me, Seymour"?
Underneath the bottom.
I don't see anything there.
So it's totally there,
but
it is not. But if you have it on your eye, I don't want to cut it off of there either because it's on my eye.
Yeah.
So I don't want to get infected there.
You should wrap your eyelash hair around it. So you can't, it's basically tissue that's growing out, so it needs blood. So you can tie a string around it and it'll fall off, right? You can snip it and it'll bleed and then it'll stop and then the scab will heal over.
Yeah.
Or you can
Pinch them
just
off like Christine.
stop having a diet that causes them. That's one option. But I'm pretty healthy too, and do I have any? Once in a while I get like one.
I can't see.
Somewhere.
I can't see anything. Anyway.
So sometimes I get them, but usually it's if I start eating unhealthy, then I notice I get skin tags.
Okay.
But they'll resolve. Like they will resolve like that if you change your lifestyle. And that's the same thing with polyps. Like we have patients that come in and they have just, you know, a colonoscopy and they have just tons of polyps and none of them are cancerous, so they're just kind of keeping a watch on them. And then we change their diet and change their lifestyle, and then when they get their reevaluation with colonoscopy, all those polyps disappear. And it's not...
So you don't have to snip your intestinal polyps off.
Yeah. But you can. You just gotta get really long scissors and just grease them up and then just blindly cut at stuff. So, polyps will go away if you stop causing them. If you cause them, so sometimes it might be diet, but the other part to that too is your liver has a process called gluconeogenesis, which says let's make sugar from scratch in response to stress. Almost every other species of animals, they make vitamin C when they're stressed instead of cortisol.
Do they have a scurvy problem?
No, they make it.
I'm just kidding.
Hmm.
Oh, I know.
Yeah.
They don't deplete it?
Right. No, they make vitamin C.
Okay.
And so then humans, so the apes then, if you look at the lineage, so then the apes then come here, and then there's these apes, or whatever they are, monkeys and gibbons and stuff. And then suddenly they lose that gene being turned on, and they make cortisol instead, and then all the way to humans, right?
Okay.
So we make the gene to convert cortisol into vitamin C. We just need to
activate it,
turn it on.
How do we do that?
CRISPR gene editing. We could do it like that, and suddenly stress makes people stronger and healthier. And that's why a lot of animals in nature...
Sometimes a little bit of stress does naturally make most of us healthier. It's when we have too much stress.
Right. Yeah. But it'll make tons of vitamin C. See what I'm saying? Instead of blood sugar. So if somebody is chronically stressed all the time, which again, buying all other people's drama, getting involved trying to change other people, which you can't, then all of a sudden your blood sugar's elevated, and you chronically do that, and you get skin tags. So, if you got skin tags in your face, you tell your friends, look, I'm not getting involved with your drama.
You see
You
this?
guys are causing me skin tags.
You see this?
Have you seen my colonoscopy?
I'm out.
This is y'all. See?
Can we start an addiction group for dairy and sugar? What do you guys think? An addiction group.
My patients can kick it like that. You know why? You cause them to have a lifestyle that doesn't require addiction. They get to be happy.
That takes some practice, and we're constantly
You should consider being a patient.
We're constantly being challenged throughout our lives all the time.
Right. So, create hormonal resiliency, neuroplasticity, and
I would bet that everyone watching here today is not averse to what I'm talking about. Dairy, sugar, and wheat.
Don't be triggered by
like
your co-host
them?
all the time.
Do you like them?
Well, of course they do.
Do you crave them?
Sugar's more addicting than crack cocaine, and wheat and dairy have morphine in them, which is 20 times more addicting than morphine as a street drug.
All I'm saying is people need support, including myself.
Yeah. So if you guys are addicted to sugar or wheat or dairy, you are a drug addict.
Hello, my name is Gina. She says, my name is Gina. I need Dr. Garrett to have an office in Olathe. See, Gina needs support.
When I go to Kansas City, I should just stop in Olathe.
There you go. Yes, you've been traveling a lot lately.
I could stand on a...
Why have you been traveling so much to Kansas City lately, Dr. G?
I don't know. It's stuff.
Why is that?
Shut it down.
Okay.
You need to stop.
I'm just reversing the...
Shut it down.
It's karma. It is karma. Can we still have ice cream? Tim is asking.
Do you know Karma Chameleon?
I know you're a dork.
Can we
still have ice cream? Can we, Tim? I completely react to ice cream.
Right, so dairy you don't want, but there is almond ice cream, there's coconut ice cream, there's soy ice cream, there's all kinds.
I think we're just
going
to have
sugar.
Basically, Dr. G just wants us to eat ice.
Oh, that's the best. Well, you cream the ice in the blender. You can make bananas in ice cream. Yeah.
That's really good.
Why don't you get excited about that?
Because it's really tasty, but then
Yeah.
it's still kind of sugary. Bananas are high glycemic.
Ain't nobody became diabetic or got skin tags from bananas.
We just keep it real here. I'm just keeping it real.
Keep it real.
Real. So, thank you, Tim, for that question.
And if you have someone that truly, truly loves you, just have them bite off your skin tags.
I thought you were going to say have them be your accountability partner, you gross.
So I put on a little, if I get a skin tag, I'll put a little cat food on there, and then I just go to bed and it's gone in the morning.
That is so disgusting. There's a reason we have not gone prime time, and I believe this is it.
We are prime time.
On Facebook.
Yeah.
Everybody's prime time on Facebook.
That's right.
Okay, so skin tags. Any last questions on skin tags? Do you feel like you know how to take care of these? Are there any topical things? Could they still do like
Well, they do.
like how you get rid of a wart?
No.
Could you still put tea tree oil or oregano on it and it would
Yes.
destroy it?
Yes, you can. But you got to be very protective of the skin around it.
Okay.
And if you clip it off, if you guys remember on Thanksgiving, was it last year? 2 years ago.
I don't know.
2 years ago, went to a friend's house, had Thanksgiving, and I was doing the dishes at the end for the family, and I turned around to talk to Rosie, and then I put my hand back in the water, and somebody put a bunch of knives in the water, and it cut my finger up, right? And then it was just bleeding profusely.
Oh, poor
And
baby.
then we tried to super glue it. I didn't have I couldn't find my stitch kit. I just put my own stitches in.
Where are we going with this story?
So,
He's trying to blame me.
eventually, over days, it was just bleeding and bleeding, bleeding. So I was trying all these things to help everybody else because I'm sacrificial like
Because
that.
he's a martyr.
And so, eventually, I mean, like, nothing helped. And then someone said to pack it with cayenne pepper or chili pepper. So I did that, and it burnt like hell, and then it stopped.
So are you
And it was
saying
fine.
people should pack their skin tags with
See,
cayenne
I
pepper?
told. No, so when they clip it, then just put some chili powder up on there.
Chili powder's not that hot.
Okay, Miss Gringo, like salsa verde. You could probably just put Tabasco. Like,
Who's gonna do that, honestly? Would you ever do that? When you are injured, that is the last thing you want is to feel more injury.
I did it.
Of course you did
But
it.
I've also survived a blizzard
Oh.
on 2 mountains over 13,500 feet, and several rock falls, and
Are you done?
a negative 30-degree snowstorm on the side of a cliff when
Right.
we were rock climbing, and
Can we move on, please?
and cancer, malignant cancer. I survived that.
Does anybody
Oh, you're just gonna
have...
brush over that? That's not a big deal. Like,
Yes,
whatever,
I am.
whatever.
Yes, I am.
All right.
Does anybody else have any questions about skin tags? Because we're gonna move on.
You should clip them,
Move.
put them in a little saucepan, then feed them to your partner, and then call the cops because they're cannibal.
It's disgusting. You're,
Is that over the line?
You're always over the line. Hello, Melody and Todd. Welcome to our controversial, inappropriate
I like
show.
Todd's last name, Curry.
It's like Tim Curry,
You can put the
Todd Curry.
skin tags in the curry.
Okay, what's next? Skin tags. We talked about warts, skin tags.
We got cellulite.
We've got cellulite, jojoba, and scars. Do you
Okay.
want to shift it to something different and
Yeah,
talk about?
you talk about jojoba.
So
Because the
first of all-
last...
black salve, good for skin.
Oh, yes, that's a really good one. Thank you for posting that, too.
Let's talk about it.
What?
That's the black salve.
Black salve, you buy this stuff and you put it on and it just kills
Hi,
and
Ellen.
eats everything away and gets rid of it.
What's it made of?
Black salve. It's made of something. I forgot.
We'll be researching this for the next show.
This is just
Let
like
me take this
Jehovah.
note.
Well, what's Jehovah? I don't know.
Do you know what it is,
Well,
Christine?
not everybody knows what Jehovah is, right? But we have people that have looked it up, and we call those Jehovah Witnesses. And she is a Jehovah Witness.
I give you permission to turn off the show right now. I would understand.
Nobody gets that unless they've been to Southern Baptist Church.
So in the 1970s,
When you were a young lad.
whaling, sperm whaling.
Oh.
Thank you, Ellen. Ellen always supports me on the show.
What's whaling have to do?
I'm glad that I have friends.
That's Ellen Awe.
She always supports me,
Yeah.
unlike some people. So,
All you need is a brawl and Ellen, and they both support you. And you're spanked.
so in the 1970s,
Yes. When you're in high school.
sperm whaling was banned.
That sounds inappropriate.
And therefore, we had a shortage. Nope. Okay. We had a shortage of sperm whale oil. Okay?
My cousin was a fisherman in the 70s, had a big boat,
Really?
got hit by a sperm whale,
Nuh-uh.
and then got pregnant.
You don't have permission to talk for the next 5 minutes.
Okay.
So, in the 1970s, sperm whaling was banned, and therefore we had a shortage of sperm whale oil. That was when jojoba oil really came into awareness and had a surgence of use. Okay? Did anybody use jojoba oil back in the 70s or 80s? If so, give us a yes.
80s.
Jojoba oil.
Andrew Dice Clay
Or how about
talked about
jojoba
it.
lotion? Anybody? Any takers? Recognize it.
Do we have any other
It
jojoba
looks
witnesses
like...
from the 70s?
That was good. I'm going to give you that one. Okay, so it is regaining recognition. If you didn't know what it was, it comes from the seed of a shrub. Oh, it wasn't born in the 70s, so Gina's a little bit too young. I know we've got some older people watching. So, if you know what jojoba is or remember it, yes, it's spelled jojoba, but it's pronounced jojoba. Anyway, it's from the seed of a shrub native to southern Arizona, California, and Mexico. And it is an unsaturated, polyunsaturated
Like olive oil.
plant wax.
Can we eat it? Can we cook with it? You know? I bet we
That
could.
was not in the research that I read,
I
but
bet
it
we
sounds
could.
like it has potential for
Because
that.
saturated?
It's polyunsaturated.
Because you can use
It's a PUFA.
the not carnauba, but the cocoa butter. You can use cocoa butter to cook with.
Really?
Mm-hmm.
That's interesting.
Yeah.
Is it solid at room temperature and liquid at hotter temperatures?
Should be.
Okay. So anyway, what is interesting about jojoba, and it, like in the past it was used as folk medicine, but science has now discovered all these other things about it. So it's high in iodine.
Wait. Did you say in the 1970s when it was used,
That's when it kind of came into...
there was all that folk medicine?
They called it folk medicine.
Like folk songs from the 70s?
Yes.
All right.
Folk medicine.
Maybe that's where
That's
it came
what Dr.
Maybe that's
Garrett
where folk medicine came
practices.
from.
Folk medicine.
Well, folk that.
He said folks. Okay.
Folks.
So anyway, there are all these great things you can use it for. It does not become rancid.
Ever?
It does not become rancid.
Damn.
It is high in iodine, 82%.
That's huge. What's iodine good for?
Infections?
Thyroid.
I was thinking about that, but it was saying that the iodine helps to reduce breakouts.
Oh, yeah. So it's great for your skin, it's great for breast tissue, it's great for your hormones. So we usually think iodine just for the thyroid, but it's actually used all over the body.
So, jojoba oil, if you need some extra iodine supplementation, and this is oil, not jojoba lotion, but jojoba oil. So if you were going to buy it, you'd want 100% organic jojoba oil, and it just takes a few drops to do some of the things that we're going to talk about.
Real quick, have you guys ever seen it at the health food store? Jojoba oil?
I have not yet, but I haven't been looking for it.
It's a carrier oil. I think it's at the health food store at the very bottom.
Yeah, it is a carrier oil.
Yeah. It's a very, yeah. Okay, go ahead. Sorry.
So, it is very similar to sebum. So the lotion that your skin produces.
Does the sebum come from the sperm whales, or
the natural lotion that your skin produces? The thing is that where excess sebum causes acne and blockage and breakouts, jojoba can actually balance it.
Nice.
So, it can be good for acne. It removes makeup, helps with razor burn. You could use it as a shaving cream. It won't clog your pores. It is non-comedogenic.
Nice.
Jojoba oil. So,
yeah, we should be using more of that.
You could use it for, did I already say lip balm? You could use it for lip balm. You could use a few drops for your hair, infections, wrinkles. It helps with wound healing and collagen synthesis, and it has very low toxicity.
So collagen synthesis is how we prevent wrinkles.
Uh-huh.
That's good.
So
if you're like late 30s like I am, you probably want to start using jojoba oil on your face.
It's probably good for lying as well. So, jojoba oil, it's making a resurgence. It's coming back. Let's see what else.
My uncle's in the Army, kills insurgents.
I've got some more. If you wanted to make a lotion, put a few drops of jojoba oil in your coconut oil. Got a lotion? Add some peppermint to it. You got a vapor rub. How easy is that?
So wait, coconut oil is a MUFA. So if you add a PUFA to the MUFA.
You've got MUFAs and PUFAs together.
Oofa.
Again. Would that, if you use that topically, does that go into your bloodstream?
Yeah.
Like if you were eating, is that the same as eating an unsaturated fat?
Yeah.
If you put it on your skin?
Yeah, you could probably eat jojoba with no problem, right? But yeah, if fat goes into fat, your skin is fat. And so fat goes into fat and then it hits your blood vessels. Yeah.
So, has anybody used jojoba oil before?
Yeah. I'm gonna
anybody from the 70s? The 80s?
Because
what's our demographic here?
As I get closer to 35, I really want to make sure I don't have a lot of wrinkles, so I'm going to start buying that.
You really also want to make sure that you build the trust of your audience by telling the truth.
I just want you to know you've always been like a mother to me.
It's getting bad. It's getting bad. So, that is our commercial for this show. Jojoba.
Or jojoba.
If you want to sound like Dr. Garrett with his Texas
tell him Dr. G told you to get some jojoba oil.
And that will also give you even more credibility.
I'm going to the health food store. I got to get some eucalyptus lemon oil, essential oil that I use for my feet. And I'm going to get jojoba oil. I'm going to start putting that on my face.
Megan says it's in her chemical-filled shampoo.
Yeah, I don't know if that's the same.
Not sure if that counts. Yeah, probably need a good ratio of jojoba to the other ingredients.
That's like using reverse osmosis water when you make your meth.
So, any questions on jojoba oil now that you know the history and its uses?
No, I like that though.
Yeah.
That's one of those things, like when you find out cashews aren't nuts and they grow on an apple. Like it's these kind of things like, holy crap, how have you lived your entire life? I mean, 34 years and I never even knew where jojoba came from.
Swear. I remember my mom buying lotion bottles that said jojoba.
Oh, that's right, she did.
You're weird. My God, you're so weird. Good for you, Gina. She's chopping up chicken for a gluten-free dish.
Nice.
So, what are you guys doing that's healthy right now? Just share. Anything new?
Because your mom had that weird clock on
You
her
need to
nightstand.
stay. You need to stay out of this.
Oh my God,
Stay
would
out
it
of
go
this.
off that you hurt my ears?
We are talking about health.
Okay.
Yeah, and you're going off the rails. So, what are you guys doing for health? What's something new? Let me think of something I've been doing.
Have you been making small, attainable goals?
Yes, I've really been watching my sugar
Mm.
and processed carbohydrate intake.
Mm-hmm.
Gina's doing gumbo. What
Gumbo?
else? What else we got going on for health? By the way, if you have any
Gumbo's
questions,
crazy healthy.
any random health questions, even if it's not skin related or based lifestyle behaviors you want to share, ask us a question.
Did you know
Ooh.
one foreskin from a baby grows a football field worth of skin for skin grafts? Did you know that?
I did not know that. That is really random.
But that means people have people's foreskins on their body when they get skin grafts. That's pretty gross, dude.
If it helps. Okay, it helps. So Ellen's making green tea from her mint leaves.
I think that's called mint tea.
Could the tea leaves be green or black, or
Well, that's racism.
white, green, or black?
No. White. That's tea. But is she putting mint in the green tea or just tea leaves?
So that is, I don't know, but Megan, that's
'Cause
so
both are
perfect.
good.
It doesn't have to be food. Tai Chi is super
Oh.
awesome for.
She's doing Tai Chi?
Yes, a moving meditation.
Damn, that's awesome.
Linda's juicing celery and carrots. Awesome. Green mint tea.
Okay. Did you ever see Tai Chi?
She had a graft. Who had a graft on her eye? Gina had a graft on her eye.
Nice. I bet it's foreskin.
Oh, that's what you were talking
Yeah.
about. She's responding to you.
She's
See,
got
I'm
foreskin
lost.
on her eye.
You know what? You just like to sound
You know what's better than foreskin?
obnoxious.
Five skin.
Oh my God. So good for you guys that you're doing some of those things like that. Ooh, one thing I also added. I added one more day of yoga. At least one day of yoga per week.
So
in
one
addition
day.
to my
one
weekend
day.
hiking or cycling,
So one day.
I added one day. That is a no. What do I want to say? I can't make any excuses.
Was there any yoga before?
There
You
was
used to
yoga,
teach
but
yoga.
it was intermittent. And yes, I used to teach, but I fell off the yoga wagon, and so I told myself I have to do at least during the week, one yoga class.
Yeah.
And it's working.
Do you do it at home or you go to class?
I go to a class.
Because it's free?
It's free at the Y.
What are you, Mennonite?
Yes. By the way, in August,
Yeah.
we're going to have Water Wednesdays. Water Wednesdays. Where you can come to the Y if you are not a member on Water Wednesdays in August.
Right.
And use the facility for free.
Oh, I'm coming there to pee in the pool then.
And it doesn't have to be in the water. They're just calling it Water Wednesdays. We want to highlight our water classes, but you can still use the rest of the facility just like any member.
What is the pee percentage of the water there?
Well, usually when we test it about 85%.
I'm going to make it 90.
Pee is sterile.
That's right.
So
wait,
this is at any of our 9 locations, YMC locations. El Dorado, for those of you who are in our wider Wichita area association.
Dang, I forgot it.
Megan's asking, when is the cooking show?
The first one is on the 1st, but we might do a live version too, like a Facebook Live, but we're doing a recorded version, then editing the stuff, and then we'll put it out. So we'll have a Facebook, I have a YouTube channel for now, but we'll probably do a Facebook channel for it. So, and that way you can have all that. And I have my old cooking show episodes I might put on there, but their quality's kind of terrible for the recordings.
I have a random question.
I have a random vague answer.
Is throat swelling always anaphylactic?
Well, sometimes it's caused by other things. So, what kind of throat swelling?
Just throat swelling as a reaction from food.
Well, sometimes, yeah, especially like the histamines. They basically, you have this kind of like tougher tissue, and so it could swell out, but more likely it's going to swell in. So then people that have chronic can have like apnea or trouble swallowing.
Oh, I didn't think about apnea and throat
trouble
swelling.
breathing, yeah.
Huh.
So yeah.
But it's different for everybody in terms of what kind of histamine reaction they're going to have?
Well, yeah, I mean, wheat and dairy does that. That's the big ones. But it could be healthy foods too. That's why we always do that test to figure it out.
Okay. The IgG.
The IgG.
Okay. So you guys, we talked about warts today. We've talked about skin tags today. We talked about jojoba today. We've got a little under 10 minutes.
Cellulite.
Do you have any questions? We still have next week, but we've not gotten to cellulite or scars.
Scar from the movie.
Do you have questions on any of the previous?
Scar tissue.
Do you want to know, do you think scars would be faster?
No, we'll do cellulite.
Cellulite would be faster?
Yes, because cellulite, I had this girl who is gorgeous, who's a friend of mine, and she's always posting all her little pretty pictures and stuff. And one day she was just like, what do I do about cellulite? And I was just like, just love your body. And she's like, yeah, but I hate cellulite. I'm like, nobody's going to give a shit about your cellulite. Like, guys don't care. Like, they're just happy someone will let them see them naked and stuff. So, don't worry about cellulite. But if you do, I always thought that wasn't really a true treatment. I always thought they were just made up and they're just hype and gimmicks and that kind of stuff.
What treatments?
Well, you see all these like cellulite treatments, and then they're usually really expensive or complicated or damaging. So, what I did this time, instead of just saying love your body, I looked up research.
To maybe help that person.
That's right. So the American Academy of Dermatology had a review of analysis of what's out there, and then how well does it work and what do they do, right? Hey, Newman.
Love you too, Newman.
So, here's what we have. We have acoustic wave therapy.
Acoustic wave therapy.
So
what does this do? Can we first of all talk about what cellulite is?
So, yeah, tell us what cellulite is.
So basically, cellulite is if you think about netting, like if you imagined pulling net
like
over,
a net
pulling netting over like a fatty piece of meat, kind of pushing down on that netting, and the stuff that pops up in different places, that would be like cellulite. So where it pops up. Yeah. So your connective tissue is like this webbing. It's called fascia that is throughout the body. It kind of holds everything together. It gives the organs and the muscles and the tissues some structure. And if you think about a big large piece of meat and you see the marbling in it, that is fascia. That's connective tissue. Yeah. So sometimes the fat will kind of pop up. The connective tissue will kind of make indentations, right? Yeah. Makes these indentations in the skin, and then you see the fat popping up through there.
Yeah. So if you have a dimple, it's the connective tissue holding, but the
fat's coming up around the dimple.
Yeah. So then a whole bunch of those, you end up with cottage cheese butt or cottage cheese legs, and who doesn't love cottage cheese, right?
Cottage cheese is delicious, I will say.
That's gross. It's curdled milk.
Can I say?
And milk's high in estrogen, and then you get a bunch of skin tags.
Let's get off topic.
Okay, so acoustic.
Okay.
You think it works or doesn't work?
Acoustic.
Sound waves to break up scar tissue.
Sound waves.
So there's less cottage cheesiness to the thighs.
But if it's connective tissue, you want to keep connective tissue. You just said scar tissue.
Yeah,
so I'm going to say no.
Tissue. It does.
It does work.
So research shows that it can help, but it requires several treatments.
Acoustic wave therapy.
I didn't think it would work either.
Okay.
It sounds made up. Then there is laser therapy, because as we all know, we need lasers. How do you do it? Do it.
No. I don't know what you're talking about.
Dr. Evil.
Oh, no. Go ahead.
Sharks with laser beams. I
No.
can't do it.
Go ahead.
Okay, so laser, there's a thing called cellulase.
By the way, does anybody have trouble with cellulite or notice it more than you ever did as a child?
Well, of course.
Who's out there?
Yeah.
I didn't have it growing up,
Mhm.
but now I do. I think it's because I'm just out of shape.
So I never had it because I had a rock hard butt. But then as I gained a little post-marriage weight, I got a little bit on my butt. And then secretly I grew hair over it. So now it looks like a baboon's butt and nobody can see it. Not a baboon.
Can we please lose
Gorilla's
the
butt.
visual image and get back?
So what women need to do is just get a hairy butt. And nobody will ever notice. You'll just be alone with your cats all day.
Just let it go. Okay.
So.
All right. Cellulase.
So cellulase is a laser, actually, it's a fiber that they put under the skin, and then it uses laser beams to break up the connective tissue.
Okay.
And it ends up causing thicker skin. So so that's as you get older, like, you were saying, as you get older, your skin gets thinner, and then there's less there to buffer that netting, like you were talking about. And so actually, as you get older, that's when people start noticing more cottage cheese, right?
Okay.
So
and sag.
the laser actually irritates it as it breaks up stuff, and it causes thicker tissue. So then that thicker tissue then would hide more of the cellulite. And so, do you think it works or don't work?
I don't know. All I gotta say
It
for
works.
myself is I've got too much to do to have to worry about this.
I know.
Like, so
Wow.
to each his own.
You also have a boyfriend, so you don't care now. I bet
I
you
didn't
2
care.
weeks before you met him, you're just like, oh my God, I gotta tell you something about me. Oh my God, nobody's ever gonna love me. And then your cats are like, you're okay.
That is so not true. No, your body it's gonna sag. You're going to age. Just accept that.
Love your body.
Take
every
good
age.
care of yourself.
Mm-hmm.
But accept yourself as you continue to do your best.
That's right. Because whatever you see, the other person's just trying to focus at the places they like, right? So that comedian, he says, don't worry about what's going on with you, because women are like 7-Eleven. You will go in there and find something you like, right? So if your breasts are uneven, they're going to find the breasts that they like the best, and that's what's going to make them happy. They don't care about all the other stuff.
That just brings up the whole question too. Who do you want to look good for? You know? Is that for men? Is that for your women you don't know? Is that for yourself? Is it for, what's it for and why?
Yeah.
So.
Well, and that's that dialectical versus dichotomous thinking. Just like the dialectical is like, am I doing this because I love my body and I want to be healthier, so I'm going to do healthier things? Or am I going to do horrible things that might cause more scar tissue and might cause more problems so that Bobby Joe likes me when I'm dancing on the stage?
Ellen, I'm so glad you asked this question because I wanted to bring this up. Does toning up, does building muscle help cellulite? I'm going to say yes. Because I feel like my legs, my muscle tone has reduced in my legs, and I've seen people who do tone up, and it changes that. You're not only losing the fat, you're gaining the muscle.
Right. So if you have a netting over this much fat, and you gain more, it starts to bubble out past that, right?
Uh-huh.
So if you tone up, you burn that fat, and you end up with less pushing against that net, so less observable cellulite.
Right.
So yes, you're right. That's one for you, correct.
So that might be the all-natural way to do it. Also, you are strengthening your joints. You are strengthening your skeleton. You are giving yourself more energy. You are becoming less insulin resistant by just building muscle. So this would be one thing I would definitely recommend. And
as women get older, that's when their skin's going to get thinner. That's when you're going to notice more cellulite.
That's when you're also going to start worrying about osteoporosis.
Right.
And you need that resistance
Right.
training.
So as a cougar, you need to be strong so you can pounce on those young guys. Right at the club?
Yeah, exactly. That's what I've been talking about. That they should be doing it for the young men.
That's right.
Can you hear my sarcasm?
Because once a guy's over 35, it's all downhill. All right.
Okay.
So cellulase.
Real quick, Christine's asking, can you help thicken the skin?
Oh, yeah.
And?
So it's collagen. So elastin. So basically, just more vitamin C in fruits and vegetables and movement. So create a need, but yeah. And then you have something called subcision.
Subcision.
Right? So we went from sound to fiber lasers to now these are needles that go underneath the skin to break up the connective tissue.
Okay.
And
here's the other thing. Breaking up connective tissue and scar tissue.
Oh.
I'm sorry to interrupt. Breaking up connective tissue and scar tissue is also helpful for joint mobility. You know, if you've had a knee replacement or a hip replacement, it's not that those things are bad, but we're talking about cellulite and vanity.
Right.
Anyway, tell me more about this.
Okay.
Subcision.
So this one, they're sticking needles in the skin to break up scar tissue. What do you think? Or connective tissue. Think that works?
I think it might break. I don't know.
See, I thought all this stuff would end up with scar tissue and then make it all worse. But the subcision called Cellifina. So there was a research where they looked at 232 patients and 99% were satisfied and it lasted greater than 2 years. Now the laser one only lasts about a year. So that's pretty good business strategy. So every year they come back in. Because usually they're going to not take care of themselves.
Key words, business strategy.
All right. So that's 2 years. Then they have something called vacuum-assisted precision tissue release.
Vacuum-assisted.
So they suck the vacuum, pull the skin, and then they do little blade incisions to cut up the connective tissue. You think that works?
Really?
I know, right? It's like from sound to lasers, to needles, to blades.
To vacuums. Yes.
So it works. And actually it said the small blades cut through the tough connective tissue. So the really stubborn cellulite, that would be the better treatment for that. And it lasted more than 3 years. Probably because you're doing a whole lot of cutting away.
Wow.
So.
That's pretty intensive.
Now
Has anybody had any treatments for cellulite?
I should probably get this done on my butt.
We should test it out.
I should do a video.
Or, like I said, you could just do some resistance training, build your muscles, feel a lot stronger, gain some energy, and just feel better overall.
Most of it's places you can't see anyways.
Without the cost.
You can't see it anyways.
Right.
Yeah. See, it'd be like guys, man. We look in the mirror, it's all messed up, and we're just like, damn, I look fun! Like,
you know, though, guys, they don't have... women have an extra layer of body fat, so you don't see as much cellulite on men.
Yeah, that's true. But I'm telling you, you look at guys and they're just like, all they see up here is like, I'm super ripped. And then they got a big, hairy, fat belly and saggy boobs and a droopy butt and funky hair, and they didn't work out the legs ever. And they think they're fine as hell.
You know, though, that's changing, though, too. And also because of pop culture and because of messages coming through magazines and the internet.
Right.
Men are also struggling with body issues. So, to some degree, probably yes. Maybe they're doing better on average than women.
But all real men have curves.
So
you just gotta find a girl that loves a chubby boy. That's all.
So we are okay. Quick.
Yeah.
We're past time. You want to wrap it up?
All right. So you tell me, does losing weight help or hurt? Because you told me the answer to this.
Losing weight.
Does losing or gaining weight help or hurt?
I thought losing weight would make it worse.
Yeah, that's true.
But building muscle would make it better.
Building muscle makes it work better. But just losing weight
alone
doesn't help.
Yeah.
It can actually make it worse.
Yeah.
And then gaining weight can make it worse because you're pushing everything against that net. And then there's carboxytherapy, where why not just inject carbon dioxide under the skin? And so it balloons you out a little bit, and it says it works. So the research shows it works a little bit. So don't do the carbon dioxide under the skin.
We got a person with a story. Hey, I've used a fascia blaster. It's basically a massage device.
Fascia blaster!
Fascia blaster.
Nice.
It's time consuming, and I don't have time for that. I hear you, Paige.
We should have,
I don't have time for it either.
Fascia blasters that you put in your car, and you do it while you're driving. And then they have retinol, which is horribly toxic. Now, if you eat beta-carotene, which is colored food, or especially orange stuff, it goes to your skin, and it helps make vitamin C and make vitamin A. It helps make vitamin A, which then helps rejuvenate your skin.
Hey guys, how about we eat well and exercise?
That's crazy talk.
And get some weightlifting in there. And wow, we're gonna have to continue that later.
No, but these are real quick. So these last few, so those are things that all work mostly, except for the last two we talked about. There's also these other ones. So there's something called endermology. Sounds made up. It's deep massage vacuum tool. The FDA says doesn't work.
Does not work.
So that's the Enderman from.
Go.
Right. Then there's ionothermic cellulite reduction treatment, which sounds pretty good. So ionophoresis is what they're doing. So they basically put algae on you and clay, and then wrap you in saran wrap, and then they basically use ultrasound technology. No, sonogram. No, ultrasound. Ultrasound.
Okay.
And then it drives those nutrients into your skin and somehow magically reverses.
Does not work.
Does not work. No.
Okay.
What about radio frequencies? That sounds like you need a tinfoil hat while you're doing that. So what you do is you put the radio really close to your booty, and it jiggles the. No, that's not right. It uses heat from radio waves to break up cellulite, and it only worked like a tiny little amount.
Does not work.
So it probably does not work. Then laser-assisted liposuction. So cold laser therapy. So that worked because it kind of breaks up the fat and then they suck it out. But then you leave dimples because you have connective tissue like this, and you sucked everything away, so then it creates dimples.
Does not work.
Does not work. Then you have ultrasound by itself, and does not work.
Okay.
Does not work.
Does not work.
And then nope, faux show. This is my own category I made up. Nope, faux show.
Nope.
Faux show is cryolipolysis, which freezes the fat away, because that seems like a great idea. That's more scar tissue and problems than you want. Then there's mesotherapy, where they inject caffeine, herbs, and hormones under your skin, into your fat, to somehow magically improve it.
Seems permanent.
And does not work.
Does not work.
And then virtually all supplements that are supposed to help
do not
work. So
really, the more physical, it looks like the more physical approaches.
Acoustic,
do more.
Cellulase, Cellifirm, and vacuum-assisted precision tissue release. But the vacuum-assisted was 3 years. The Cellifina was 2 years. And then the laser was about 1 year. And then the acoustic one takes several treatments and it said it can't help. So I don't think that's as long-lasting.
Or you could just eat healthy and exercise.
That's crazy talk, son. Why are you always
save your money,
crazy?
Feel better, lose weight, gain energy, improve your insulin resistance, reduce your osteoporosis.
Just find somebody, learn all the weird things about them that they never want anybody else to know, so they can never leave you, and then just let yourself go. That's all you need.
That's your takeaway for tonight.
That's our RTE word of the day. Phrase of the day.
Okay.
All right, so next week.
Next week's the last show on skin. We'll try to
Skin.
make it interesting. We still didn't talk about scars or eczema.
Scars.
What do you guys want to learn about? We need to
Eczema.
know. Next time.
Apparently, we can't get through too many topics in an hour.
Thanks to the Boston Dog. You are very welcome, Christine. We have a good
Nice.
time doing this. Tell us what you want to know next week.
So scars, and we have what?
Scars and
Oh,
What is it?
acne. Oh, and
we
eczema,
never talked about acne.
and eczema and psoriasis.
Eczema. Okay.
So that should cover
Scars.
maybe rashes. We'll throw all that in there because it's
Okay.
inflammatory stuff.
Okay.
And then next month we're gonna do Vagitastic Talks, where we talk all about the dirty vagina and how it should be dirty vaginas, so you have a healthy vagina. A healthy vagina is a dirty vagina. Do you know that?
I did not.
I'm gonna start telling people on the street.
I'm sure you will.
Mm-hmm.
All right, folks. Thanks for watching tonight. We will see you in a week.
Don't touch that button.